Okay, good day. So now we will have a look at the hand. Okay, this is palmar view of the hand, palmar surface of the hand, and you can see that this is thumb. So this is lateral, little finger. So this is medial. Okay, this is thenar muscles. This is palmar aponeurosis, and this is hypothenar muscles. Okay, here you can see lateral here. This is radial artery. This is palmaris longus tendon because it attaches to the palmar aponeurosis, and this is medially here. This is ulnar nerve, and lateral to that is the ulnar artery. Okay, again, this is palmar aponeurosis, and in the fingers, okay, this is digital sheath. Remove the digital sheath, and you can see the long flexor tendons. Here you can see the flexor digitorum superficialis tendon. You can see that it is splitting into two and allowing the flexor digitorum profundus tendon beneath it to pass through and to attach to the base of the distal phalanx. Remove the tendon of flexor digitorum superficialis. You can see tendon of flexor digitorum profundus here, okay, attaching to the base of the distal phalanx. Remove the flexor digitorum profundus tendon. You can see the bones, the proximal phalanx, middle phalanx, and distal phalanx. Okay, now let's remove the palmar aponeurosis. So we've removed the palmar aponeurosis. Okay, now let's have a look at the thenar muscles here. Okay, the outermost muscle here, the lateralmost muscle here is the abductor pollicis brevis, and medial to that is the flexor pollicis brevis. If we remove the abductor pollicis brevis, we can see the opponent's pollicis. Okay, now let's have a look at the hypothenar muscle. Okay, the outermost muscle of the hypothenar muscle, the most medial muscle, and little finger, so medial, the most medial muscle is the abductor digiti minimi, and lateral to that, the inner muscle here, it is the flexor digiti minimi. If you remove the abductor digiti minimi and flexor digiti minimi, you will see the opponent's digiti minimi. Okay, here you can see tendons. These are the long flexor tendons, flexor digitorum superficialis tendon, and beneath it there is the flexor digitorum profundus tendon. You can see muscles attaching to the flexor digitorum profundus tendon. These are the four lumbrical muscles. Okay, starting from the lateralmost side, thumb lateral. So this is the first lumbrical muscle, second lumbrical muscle, third lumbrical muscle, fourth lumbrical muscle. Okay, now let's have a look at the arteries. Okay, let's start with the ulnar artery here. You can see ulnar artery descending on the medial side of distal forearm, and this ulnar artery will pass superficial to the coarse, superficial to the flexor retinaculum. This is flexor retinaculum. Ulnar artery, coarse superficial to the flexor retinaculum, and then it gives off a branch. This branch is the deep branch of the deep palmar branch of the ulnar artery, and then the ulnar artery continues into the hand as the superficial palmar arch. Superficial palmar arch. You can see that superficial palmar arch gives off three branches here. These branches are the common palmar digital artery. And in the digits, before and this common palmar digital artery will divide and branch, giving two proper palmar digital arteries that runs on both sides of the fingers. This is the proper palmar digital arteries. Okay, on both sides. Okay. Okay, now let's have a look at the radial artery. So this is, okay, again lateral because of the thumb. You can see this is the radial artery. Before the radial artery curves around the lateral wrist, it gives off a branch. This branch is the superficial branch, superficial palmar branch. And this superficial palmar branch, you can see, it pierces the thenar muscle. This is thenar muscle just now. Okay, you can see that the superficial palmar branch of radial artery pierces the thenar muscle. Pierces the thenar muscle, and it continues into the hand. Okay, and it completes the lateral end of the superficial palmar arch. It completes laterally the superficial palmar arch. Okay, now let's remove the long flexor tendons and the lumbrical muscle. Now we can see the metacarpal bone and muscle here. This is one of the palmar interossi. This is the third palmar interossi. And here they have removed the palmar interossi. You can see the dorsal interossi. How can I tell that it's the dorsal interossi, dorsal interosseous muscle? Because it is bipennate, dorsal interosseous muscle. This muscle here, you can see it attaches to the proximal phalanx of the thumb. This is adductor pollicis muscle, adductor pollicis muscle. Here you can see an arterial arch here. This is the deep palmar arch. Deep palmar arch formed by the continuation of the radial artery. Continuation of the radial artery is the deep palmar arch, which is completed medially by the deep palmar branch of the ulnar artery. Okay, here you can see an artery here that goes to the thumb. This is princeps pollicis artery. Princeps pollicis artery. Okay, now let's have a look at the dorsum of the hand. Dorsum of the hand. Firstly, let's have a look at the radial artery. Okay, I repeat again. This is lateral here, thumb. This is radial artery. You can see the radial artery curving the lateral wrist. Curving the lateral wrist, and then it crosses the anatomical snuff box. I want to show you the anatomical snuff box. This is the anatomical snuff box. Triangular shape. Anatomical snuff box. Its lateral boundary here is formed by this tendon, which is the abductor pollicis longus tendon, and this tendon extensor pollicis brevis tendon, and the medial boundary is formed by this tendon, and this is the extensor pollicis longus tendon. And you can see radial artery crossing the floor of the anatomical snuff box, and you can see this nerve here crossing the roof of the anatomical snuff box. This is the superficial branch of the radial nerve. Okay, now let's focus on the radial artery. Radial artery cross the floor of the anatomical snuff box, and then it leaves the anatomical snuff box and goes to the first dorsal interosseous space. This is the first dorsal interosseous space. And you can see the radial artery piercing in between the two heads of the first dorsal interosseous muscle. Radial artery piercing the two heads of the first dorsal interosseous muscle. Okay, now let's have a look at this structure here. This is the extensor retinaculum. Extensor retinaculum, and you can see tendons here on the dorsum of the hand. This is the tendon of the extensor digitorum. And it is interconnected by the intertendinous connection. Okay, on the dorsum of the fingers, here you can see dorsum of the medial forefingers. This is the extensor expansion. Extensor expansion. The base is over the head of the metacarpal bone, and the apex is at the base of the distal phalanx. Extensor expansion. Okay, so that's all for hand. Okay, thank you.